So my next question moves on to vaccinations, which is a hot topic these days. We know that persons like Bill Gates is heavily involved. So my question with regards to vaccinations, what is the typical process for accepting and issuing vaccines in Grenada?
Well, our vaccination protocol and schedule is guided by the technical support of PAHO, World Health Organization, on the need and the type of vaccines that are used. And I'm sure that if a vaccine shows up for COVID, it would be a similar route. We do depend on PAHO and CARFA to guide us in that direction. So we would not be unilaterally going out and using the vaccine, because it must go through its process. Vaccination, however, as you indicated earlier, is a very topical issue. And I'm pretty sure that, as you know, a lot of resources have gone into the provision of vaccine. The interesting thing to me, though, as a public health practitioner in the Caribbean, is would a vaccine that is developed in Europe or Asia or the United States, first of all, would that vaccine be effective for Caribbean people? How efficacious would that be? And that is a public health discussion that has to happen, because the efficacy of vaccines has to do a lot with a lot of physiology, a lot of genetic sequencing. And let me just say, the trials of these vaccines, would the trials happen in the Caribbean as well? Because it is true that if your genetic sequencing puts you in a different gene pool, a vaccine that works in a geographical area may not necessarily work in a B geographical area. So
that's right.
Yes, it is an interesting public health dilemma that we would have to face when that time comes. And I can stretch that argument and stretch that discussion to say, let's not be unrealistic. The COVID has not happened in the Caribbean the way it happened in the rest of the world. So
it has not.
What's happening in the Caribbean? It's an interesting question.
I'm so happy that you shared that with us, because that is a genuine concern when it comes to clinical trials. You want to make sure that you have representation from persons of different nationalities because of the genetics. One medication works well for one race, and it doesn't necessarily work well for someone else with a different genetic setup. It's very complicated, not so?
Yep. Yes, it is. Even for other types of medicines, antihypertensive medicines, for one example, is very clear that the antihypertensive protocol for the Black population can be different for the white population in terms of which drug you use first, which one you use second, which one you use third. And it speaks to the heart of the difference in genetic makeup of different tribes and different people.
So therefore, should Grenadians have concerns about the source of the vaccine?
I think everyone should have concerns, not just Grenadians. I think everyone should have concerns. Whenever there is a novel infection, or whenever there is a new disease of whatever kind, the management of it should always be a concern to people. This is why medicines have side effect profile. And I have, in my own personal experience as a practicing physician, have seen person A have no problems at all from medicine, and person B developing the same medicine, developing the side effects of those medicines. So it is a genuine concern that I think everyone should take into consideration. But I don't want it simply to be said that people should be concerned. Yes, you should be concerned, but you yourself has a personal responsibility to do something about that concern. If you don't want a vaccine for a particular thing, don't stop there. Protect yourself so that you don't get the virus. It's similar to saying dengue. No one wants to get dengue hemorrhagic fever. Every Grenadian should be concerned about dengue hemorrhagic fever. But don't just stop with a concern. Clean your surroundings, get rid of your mosquitoes so that you don't get dengue. And that has always been my cry. Too many times we end prematurely our concern because we don't want to take responsibility for making sure that those concerns don't become a reality.
There were comments made by Italian scientists a few months ago, perhaps a flippant comment in terms of wanting to do different trials in one of the African countries. What measures will be put in place to protect Grenadians from becoming guinea pigs in someone's trial?
Well, this is one where we expect our regional public health agencies to take a lead on. Our region has there's a concern for the region, in the sense that our small islands, we don't have strong legislation that speaks to the use of human samplings or use of human subjects for research purposes. So I'll make a blanket statement to say that because we have weak legislations for human samplings, a company can request to use the Caribbean as human subjects. It will be left up to the governments and the public health on ministries to make a final decision on it. My personal opinion as a practicing physician is that because of the absence of legislations that deal with protection and intellectual properties for research of that nature, that our region hold back on allowing ourselves to be used in that regard. I know that there has been sporadic human samplings in the last decade in the Caribbean. Jamaica was, used one at one point in time, and I think either Barbados or Trinidad also used. Those cannot be confirmed, but I know Jamaica could be confirmed. And so this is where I would expect our CAFA, for example, or PAHO, to get ahead to guide the region in that regard. As a matter of fact, I think they should not wait until requests are being made for human samplings in the Caribbean, and that legislation should be looked at, because it is going to come. It is going to come, and we, even for our own benefit here in the sub-region, we should put things in place to ensure that we benefit from any type of research and samplings, because diseases are going to be with us forever. And because it's going to be with us forever, we have to constantly change our process and constantly monitor so that we develop our own treatment protocols and so on. This could only be done by doing the appropriate research. And in so doing, we get a chance to prove whether our own natural resources, our own herbs, our own treatment that we have here, can it work? How does our cocoa and a nutmeg, how does our cinnamon, can it help with lowering our blood pressure? Our sorrel, our anti-inflammatories like saffron and so on, those COX-2 inhibitors, those are things that we have here on the island that, if guided by good legislation and good scientific institutions, we can develop our own research here for us in the Caribbean. UWI has a responsibility here as well. St. George's University has a responsibility here as well to make sure that research that has benefited the rest of the developed world, those same research can benefit us and not being taken advantage of by the more richer countries.
Well, we certainly hope that protocols will be put in place to protect Grenadians, people in the region, the Caribbean region, who, as you said, did not have the same level of impact as the more developed countries. We had solid plans in place, and the majority of our citizens were protected from the harsh lash of COVID-19. Dr. Martin, thank you so much for your time. We really appreciate your time today. This was Rosin Douglas with Central Health Grenada as we continue our series on COVID-19 and those most at risk. Thanks for joining us.
Thank you.